Everybody has got the ability to choose their GP practice, but generally there's limitations to that, and people only register with the GP which is in the direct catchment area or boundary. These boundaries are used by GPs to define the area in which they will provide a home visit, because if you register a patient as a GP, you've got a compulsion to visit patients if there's a clinical need. Due to those boundaries, it also may mean that some patients only have got a choice of 1 or 2 or maybe 3 GP practices. There are fewer GPs in poorer and disadvantaged areas, and that means that patients have limited choice despite having greater health needs. Many patients are very happy with the current GP practice, but others are unhappy, citing problems with opening hours, the ability to get a convenient appointment, and getting in touch with a practice by telephone. The most common factor that prevents people from registering with a GP of their choice is the positioning of the practice boundaries or catchment areas, and these are agreed between the GP practice and their local PCT. The consensus of the consultation process so far is that an overwhelming number of people feel it's right for people to have the flexibility, and therefore it's important to make this work. As I said, it's not just an academic sort of exercise, or there's a genuine perceived need to get this going. And the new government will review response from the consultation, including the feedback from the events, and publish its proposed way forward later this year in the autumn. The coalition has stated our programme for the government is that we'll give every patient the right to choose to register with the GP they want without being restricted by where they live.